3 more thumbs up. So we got the right people here. So maybe what I could do is ask each of you one at a time, kind of share a little bit about yourselves. Kind of, I'll start with Amber if that's okay. I've got her first on my screen here first. Amber, do you mind kind of just introducing yourself, and for those of you that don't know what a pharmacy resident is, what that means?
Absolutely. So thank you everyone for having me today. My name is Amber Doldalau. I am a pharmacy resident. I am a licensed pharmacist, just graduated and training now. So I'm completing, thank you. I completed pharmacy school. So I'll backtrack a little bit. So I was born and raised in Hawaii, and I went to elementary school, middle school, spent all of my time on all of that time in Little Island, and then graduated high school and figured that this is my time to explore. So I went to college at Washington State University for my bachelor's degree in chemistry. I got that done in 4 years, and then went on to pharmacy school after taking maybe a semester break, and then completed 4 years of pharmacy school, got my doctor of pharmacy, and then I matched here with Virginia Mason Medical Center, or now Franciscan Health in Seattle. And this program is essentially a program that is, I guess, geared towards, inpatient in the hospital training for new licensed pharmacists, as well as having some clinic opportunities there to kind of have that patient interaction. And it's more than just being locked up in a pharmacy in Target or in Buck Pavilion downtown here. So I get to work closely with patients. I work closely with doctors and nurses and MAs in the clinic. So we work all very closely together, and basically training so that when I'm on my own in June, I'll be, very competent in terms of applying the skills that I've learned. So my interest started back in high school as far as knowing what I wanted to do. I got a little taste of the medical field because my mom is a nurse, and she's worked really hard, and she showed so much compassion towards everyone in her life, and especially towards us as her kids. So I wanted to, follow that example, but she geared me into a field that pushed me beyond what she thought that I could do. And she voluntold me to go to a pharmacy and just shadow and learn about what they did. And ever since then, I fell in love with it. And it really aligns with my interest in chemistry, which is my bachelor's degree. So that's kind of where I went. I did stumble along the way, but I'm very lucky to be here at Virginia Mason. Oh, Ian, I think you're muted.
I am, thank you.
Yeah.
Thank you so much, Amber. Elena, would you mind going next and introducing yourself and kind of explain what you do at Virginia Mason?
Yeah, absolutely. Hello, everyone. My name is Elena Smith, and I am a registered nurse. Oh, this is Zelda as well. She likes to make an appearance every once in a while. So I'm a registered nurse at Virginia Mason. I specialize in the operating room. And of course, within specializations, there are subspecialties as well. So at Virginia Mason, my main specialty is cardiac surgery. So my daily basis is open heart surgeries, as well as lungs and vascular. But of course, you can trickle in a little facial plastics or head and neck surgery and that kind of thing. I have been in the operating room. This will be my 5th year in September. Time really does go by a lot faster than you think it does. But I am very excited about the experience that I have had and that I will continue to have in the operating room. I am a Seattle native, born and raised. I went to Nathan Hale High School, if any of you are familiar with the local high schools in the area. Both of my parents were nurses. They met as nurses in the operating room, and 20 years later, here I am. It has been quite the journey for me figuring out whether or not nursing was something that I wanted to do. I, as well as Amber, was influenced by my mother. Instead of steering me towards the doctor route, she steered me towards the nursing route. So healthcare and nursing has been a part of my life since I can remember. And I just really enjoy the complexities that are involved in healthcare and the broad range of professions within healthcare, and even within nursing alone. You can, like me, I'm in the operating room, but there are so many other subspecialties, and you can be in the clinic, or you can have your own practice. And there are just so many options with nursing, and that's what I love so much about it.
Thanks, Elena. Missy, would you mind going next?
Hi, guys. My name is Missy. I am also a Seattle native, and I have been with Virginia Mason for 5 years, almost. But I just started my career in healthcare 3 years ago. I was working in a non-clinical role, and I knew that I wanted to go into healthcare. I knew that when I was in high school, but I kind of had a roundabout educational journey. So I went to massage therapy school first, and then I found out about an apprenticeship through Virginia Mason. And so I was actually able to do my medical assistant training here. And this is, I'll have been here as a medical assistant for 3 years in August. With my first year being on the job training in my apprenticeship. I work in dermatology now, but I've also been able to work in a plastic surgery office and in a wound care center, where in wound care and derm, we get to work pretty much the top of our scope. So there's different duties in different departments, and you can do a lot, kind of like nursing. You can go to kind of any department, any type of medicine, and get some experience and do different things. I also like being a medical assistant because the exposure to all the different things is a great stepping stone for further education. So I'm planning on pursuing more education, and I think being a medical assistant is just a really great way to get your foot in. And if you know you want to be in healthcare, but you're not quite sure what part of healthcare you want to be in, it could be a really great place to start, because you can actually become an MA right out of high school. And most programs are 1 year to 2 years, depending on what kind of MA certification you get. And then you can kind of get exposed to a bunch of different careers in healthcare and see what might be a good fit. And because everyone else was influenced by their mom, I'll mention my mom was actually an MA for 30 years. So I think that's probably where I decided to do it. I was like, yeah, my mom did, I can definitely do it. And it's worked out really well for me. So yeah.
I promise you, though, that's not an interview question we ask if your parents worked in healthcare. It's not, it just happens to be a common theme with our panelists today. That's not required. My parents did not work in healthcare. My dad wanted me to become an engineer. So anyways, it's not about me. Thank you all for that great introduction. We do have a chat feature as well. So if there are questions you want me to ask specifically of any of the three of them, please feel free to chime in. Otherwise, I'm going to just ask some questions away, and I'm going to kind of do freestyle. So if any one of the three of you want to answer it or feel compelled, just jump in if you would. So as you think about your background, what sort of interests or abilities and skills would help a person be successful in your role?
Yeah, I'll start, because as a nurse, very much science-based, but something that I think I find a lot of interest in is just the body in general, not only anatomy, but how your body and how everyone else's body reacts very differently to very similar situations. And I mean, as an example, and the reason why we're on Zoom today, the pandemic that we have experienced, it makes me feel so curious as to why certain people react so substantially to the pandemic that we're going through, whereas other people are having a very lax physical response. So what I find so interesting is just how dynamic all of our bodies are, and how just the range of experiences that we can all have, like in terms of allergies or in terms of our reaction to certain medications. I just find that to be such a wealth of information that we can all continue to research and experience together. So if you are interested in just how our bodies are working, and a lot of it is just a big question mark for a lot of us in healthcare, I find that constant learning experience just so eye-opening.
I can kind of piggyback on Elena with the constant learning experience thing. I think being an MA, it's definitely a role where you need to want to learn a lot, like all the time, because things change in healthcare pretty rapidly. Whether it's a new department that you're going to, or just a process in your department that's changing. I know I went to a lot of different schools, and I learned a lot of different things. So I think that's definitely the primary thing for being an MA, is wanting to learn. And also customer service. So if you've ever had a customer service role, as an MA, you're kind of the face of the clinic. You're the first person, usually other than the front desk, that the patient sees. You're the first person they have a conversation with. They have to be comfortable telling you what's going on with them, so you can write it down for the doctor. And you get a lot of face time with them. So it's important that you are comfortable working with people from all different areas of life. And if you happen to be the kind of person who can handle like difficult people and have a way of like, finding some calmness with them or whatever it be to make the situation better, you might be a really good MA.
Yeah, and I kind of like to briefly piggyback off of that as well. I think, constantly learning, if that's an interest that you have, or solving problems. I know as like an MA and an RN, you experience these problems that don't have some very straightforward answers to, and we all work together to try to figure out and critically think. It's kind of like a puzzle. So it's like those escape rooms in a sense, but with like the human body, or like interacting with people. I think that's the thing that really draws me into the medical field in general. And as a pharmacist, being very specific to medications, and, being that person that people go to when they have questions about side effects, or, hey, have you seen this medication used for this before? Like, what are your thoughts? And you're like, that's a good one. I've never seen that, but I guess how can we apply what we know about it and maybe critically think, like, is this a good option or not? And, talk about it with the patient and with the team, just to figure out what's best. But I think, yeah, definitely constantly learning, having good social skills and interacting with people and problem solving will definitely bring it all home.
Great responses. Thank you each for that. What are some of the most challenging or rewarding aspects, would you say, of your career so far?
I can go first with that. So one of the challenging things about an MA, and this can kind of change with departments, but a lot of clinics are really busy. And in Virginia Mason, our role is the flow manager. So to make sure that our doctor's on time, that we're getting patients back and they're getting their full appointment time. And it can get kind of hectic. So being able to manage everything that's going on. For example, I was late to the meeting because we had a biopsy. We actually had like 3 back to back. So it can just be, it can be hectic. So I guess like maintaining my cool and like being like, okay, everything's gonna get done. It's a challenge, but you can learn to manage it for sure.
For me, since my experience is predominantly in cardiac surgery, I find that my most challenging and my most rewarding experiences are fairly similar. My most challenging experience being like an end of life and going through that type of experience with a patient and the patient's family, and acknowledging the life that they had led up to that point. But that being said, my most rewarding experience is preserving life. In emergency situations, if I encounter someone who is on the brink of life and death, and the team that I'm working with works together to have the common goal of preserving as much ability for this person as possible, it is so uplifting for me to experience working really hard to make sure that we can allow someone to live another day, see their loved ones again, enjoy the things that they love again. And hearing the after a really difficult situation or a really difficult case, and hearing that, oh, you know, we really helped someone and they're alive and well today, it is so heartwarming for me.
All right, I'll go last. So I think the most, I guess the biggest struggles that I face is not knowing the answer to everything. You know, as a medication expert, a lot of people come to you asking for the answer, but a lot of the times that you don't know. And that's where the critical thinking part comes into play. And it is a struggle. You know, you have to really be creative in the ways you find your answer. And sometimes it's trial and error, and you won't know until you try. But the other hand, on the other hand, the most rewarding is when those things do work out. So, you know, when you find a medication that works best for someone and they feel better on it, then I think, you know, that's very rewarding. And then also being a part of the team, knowing that you're contributing to something that's bigger than yourself, you know, it always comes back down to the patient and keeping the patient at the top of the pyramid.
Thank you, Amber. Amber, you mentioned working in a pharmacy before. Your mom encouraged you to do that. And this question is for any of the three of you that want to answer this, but what sort of part-time jobs, internships, or extracurricular activities did you do, or do you think would be best in preparing someone who's interested in doing what you do?
Yeah, so how I got started was I started shadowing a pharmacist at a local pharmacy back home. It was a very small pharmacy. I started shadowing, and, you know, I started being curious and asking like, oh, can I help you with that? And then eventually they hired me on. And a lot of the time, actually, after high school, too, a lot of people can start as technicians in the pharmacy and get that experience. So you have technicians in the community or retail pharmacy, but you also have technicians in the hospital. So there are both sides to it. And that's one way to get experience under your belt and understand like what a pharmacist really does. And then once you've got that experience, you can move into an intern position once you're, you know, in pharmacy school and training. So there is, I really encourage everyone that if it's something that you're interested in, definitely step out of your comfort zone to shadow or get insight about what they really do, because there's stuff that we think we know, but there's always more to that. So, yeah.
Thank you. Does that question speak to the other two of you?
Yeah, absolutely. For me, I had spent a lot of time in the hospital prior to being a nurse. I worked as a nursing assistant after high school and when I was in college as well, just as a part-time thing, just to see what roles nurses had. And like Amber, I also shadowed a lot. I would just meet people and ask and see if it was okay for me to follow them around for a day and ask them a whole lot of questions and find out how they got into the position that they're in. So it was just a lot of exposure, a lot of asking questions, and trying to find a way to be involved as much as possible in the healthcare setting.
Thank you. We've got one question that's come from our attendees here. They're asking, what can I do in high school to prepare myself for wanting to be a physician? Well, none of us are doctors here, or do we play them on TV? So it's gonna be a little harder for us to directly answer that, but I think there are things in terms of just getting involved. So I know in a non-pandemic time, there's opportunities to volunteer at hospitals to get some exposure in healthcare. I know taking sort of certain coursework is also kind of helpful as you think about classes that can help you be more successful in college. But maybe if anyone else wants to chime in terms of things that were helpful to you that you did in high school to kind of prepare you for your next position.
I have a comment about this. I didn't, I think I didn't do a lot in high school to prepare for a career in healthcare. But now that I'm in healthcare and I pursue further education and I look at the requirements that it takes to become a physician, I found that it wasn't a bad thing that I hadn't done a lot before, because I got so many different experiences. When I was in high school, I worked at a zoo, and I also volunteered at like a school. So I did a lot of different things that still kind of come back to me now, and I know will carry forward with me later. So if you're, you know, maybe a graduating senior this year, or even if you're younger, you know, if you feel like you haven't done anything yet and you need to start doing stuff to be a doctor, just know like it's never too late and you can start whenever you want. And I think volunteering at a hospital or in any kind of care setting or customer service setting would definitely be something you'd want to check out.
Adding on to that, Missy, I ask the physicians that I work with how they choose their residents. And oftentimes we'll have visiting medical students come through the operating room, or people who are getting ready to start their residency and do interviews with the physicians that we do work with. And I ask them, how do you choose? How do you know which one is going to be the best fit for this program? And a lot of what they have to say is their extracurricular. Like, of course, the students do really well in school, they have good grades and that kind of thing, but standing out in your extracurricular life shows people that, hey, wow, this person can balance having a job or playing a sport or having X, Y, and Z hobbies, and showing interest in so many things outside of school kind of shows people what kind of person you are, what kind of responsibilities you can take on, how willing you are to go above and beyond to make yourself fit the profile. So there are so many things that you can do in school, but they don't necessarily have to be healthcare related.
Yeah, definitely. I resonate with what you said, Elena, because in high school, I was actually part of Army JROTC. So I was really involved with, you know, military training and all of that, and being in uniform all day. And I feel like those foundational experiences has given me the skills to interact with people and with patients every day. So definitely don't feel like it has to be just such medication focused, because if you want to be a physician and you're interested in like something random that, you know, puts you out there and gets you involved, definitely go for it. I think that, you know, any experience and building those connections and networking with people will lead you into where you need to be.
I think that's really good advice. Thank you all for that. Next question we've had come in. Is there anything I can do as a high schooler to help me go to the pharmacy route? I know a lot of things you have to do, be at least 18 to do, and have some sort of license to get a job, volunteer, or shadow. Do you mind fielding that one, Amber?
Yeah, definitely. No, So as far as the law goes, to be a licensed technician, I believe you do have to be 18. If not 18, at least 16. But I think there are a lot of opportunities for shadowing, as far as, just talking with a pharmacist or someone who knows a pharmacist. There are also independent pharmacies, so little mom and pop pharmacies that are more of like family oriented, and they're always welcoming, rather than your local CVS who are like always really busy and slammed, and you don't have that time and luxury to really delve in and ask questions. So I think that's a good place to start, is like finding maybe a local independent pharmacy, and just putting yourself out there and be like, hey, like I'm really interested in learning about what you do. I think if you have any like bandwidth to allow me to shadow a couple hours a week or an hour a day, I would really appreciate it, as it'll help me. Pharmacists, I think, are always looking forward to sharing their knowledge with the next generation. So I would be surprised if someone were to tell you no. And I hope that doesn't happen.
Yeah, just and to add on to Amber, I think the other thing you can do is making sure your network knows that it's of interest to you, because you might not know somebody directly, but someone who who knows somebody's cousin might be a pharmacist at a smaller place. So I think by putting yourself out there a little bit as well and saying, this is something I'm really interested in learning more about, and having your people around your connections know that, you might be surprised. There's a lot more points of connections than we could ever imagine.
Yeah, and don't restrict yourself to just retail pharmacy as well. Those are like the most accessible if you were to just walk into one, but there's also pharmacies in long-term care facilities. So if you have like grandparents that are staying in like a nursing home, they have a pharmacist there. So, trying to reach out and tell the nurse that's caring for your grandparents, like, hey, I'm interested. Could you like connect me with the pharmacist that works here? So there's a lot of different like similar to nursing, little different spaces for different pharmacists in different settings.
Thank you, Amber. So a lot of times there's misconceptions about people, what they do and what their role is. What do you think maybe is the biggest misconception people have about your profession?
I know before I became a medical assistant, I was kind of under the impression that we didn't get to do a lot. And even in my first role, I felt like, oh, I'm just going to do a lot of like rooming patients and dealing with insurance stuff. But there's actually a lot that medical assistants can do. So like a lot of hands-on things. And so it's just a nice, just so much that you can do. So don't let people make you think that being a medical assistant is limited in scope, because there is a lot to do. But it's also nice because if you don't want to be super hands-on, if you don't want to see a lot of blood, but you want to be in healthcare, you can do like more clinical roles that do involve insurance and stuff like that. So yeah, I think people just don't know all that medical assistants can do.
Thanks, Missy.
I find that sometimes our media portrays nurses one of two ways. Either they are the overbearing, over-loving, do everything type of person, or they're like the Nurse Ratched from One Flew Over the Cuckoo's Nest, and just really mean and very scary. But what I'd like to say is that nursing is just so busy, in the sense that like there are so many things that you can do and so many options within nursing. And because it's so wide, there are so many people involved, and with people comes different personality types. So in reality, you can make nursing and healthcare whatever you want it to be. It doesn't really fit a mold, and it doesn't fit whatever TV portrays nursing to be. It's however you make it.
Thanks, Elena.
Yeah, that's funny because my mom is very overbearing and overloving nurse, but I think it's awesome. I love my mom. As far as pharmacy goes and the misconceptions, so there are, the pharmacies that make you wait forever in line and they count pills by 5. So those do exist, but that's not the only thing that pharmacists do. So as far as being in the hospital, we have what we call a collaborative drug therapy agreement, which allows us doctors of pharmacy to write prescriptions under the physician's name, because we have that agreement where we can, care for patients such as them and help them out and work collaboratively together. So that's one thing that we take advantage of here at Virginia Mason. We really prioritize, working at the top of our license. So sometimes even in the anticoagulation clinic or cardiology, you'll see a pharmacist seeing their own patients, and they'll, talk about their medications, and then they'll schedule follow-ups, and we'll send prescriptions to CVS Pharmacy, and sign our names on them, and then we'll, care for them like a physician does. So that's kind of where pharmacy is going, in the direction of trying to be a provider and, really care for patients just like everyone else does. And then we have other investigational drug pharmacists that do work for like Merck and industry, and they do research and talk about, new drugs that are coming out. And so that's kind of like another area blowing up. And then you have pharmacists in the hospital that work with the nurses. We call them and say, hey, is this like something that you're going to give to the patient? Can we talk about it? Blah, blah, blah. And yeah, so there's pharmacists everywhere in every little nook and cranny, not just behind the counter counting by 5s.
Thank you, Amber. You guys all talked about, I think, the importance of being kind of lifelong learners and continue to adapt to changes. Healthcare is ever evolving. Has technology changed in your role? And if so, or not, what changes do you see coming in the future?
I'd love to answer this question because both of my parents were OR nurses, like I said earlier. And so after every shift, I call my dad and tell him what I did. And the dynamics of how technology has evolved since when he was a practicing RN versus now is astronomical. We have these giant robots in the operating room that help us perform certain types of surgeries, where the surgeon is operating the robot from a separate console, but the robot is, I guess you could say, doing the bulk of the surgery. Since I've started within the last 5 years, the robot has evolved so significantly. And now instead of having 4 separate arms where the robot enters a person, now it's just one. And you can do this massive surgery through an incision probably this big. When my parents were in the operating room, that was it wasn't even a thought in anyone's mind. A lot of the procedures that we do now on everyone were originally just done on a select few group of people. So technology has expanded astronomically, and the advancement of technology changes my practice almost on a daily, weekly, yearly basis.
Thanks, Elena. Anyone else want to field this one?
Yeah, I think I'll chime in just a little bit. So just like, robots are taking over the OR room, they're taking over pharmacies. So they're counting pills and bottling them for us is one thing. And then in the IV room, when we are making up IV infusion bags, there's some machines that will automatically do it. So I think that's where we're going as far as medication wise. And that's, I think, the biggest thing. Yeah, robots are going to take over.
Not completely.
to
No,
some
but
extent.
they're counting, they're doing more of the pill counting, right? Some of the more
Oh,
basic things.
yes.
Allowing you to do other things like meet with patients and help understand their needs. So,
Saves a lot of time.
yeah. I'll throw this one out to you. How do you balance your work life and your home life?
I think I'll speak to this first. So I think it's really, um, I guess as a pharmacy resident that's training, just graduated, you anticipate that this upcoming year is going to be pretty intense in terms of training, kind of like a medical resident. So at some point you kind of just accept it. But I think it's really important, especially now in the times of COVID, to understand self-care, because burnout is real. And you guys, even in high school, probably experience, you've been studying, you go to practice, and then you come home to do homework. It's really important now to kind of set your boundaries and realize, okay, I'm pretty tired today. I've socialized a lot. I think I need to focus on myself and do something I love. So on the weekends, when I'm not working, I definitely take advantage of spending time with my dog outdoors. So we either go on walks at the park or we go on hikes, or when it was snowing, I went snowboarding. So definitely being outside is something that really recharges me. And when I feel recharged, then I can, work better with patients and give them the best patient care that I can.
I love that, Amber. I do the same thing. With nursing, I find that scheduling can be pretty flexible. There was a period of time I was only working 3 days a week, but 12-hour shifts. So they were very long working days, but I had 4 full days in my week to do whatever I wanted. And like you said, I believe self-care is the most important thing that you can do, because we're going to be in this profession for essentially however long we want, and to enjoy that time, I schedule in all of the things that I enjoy doing on the days that I'm not working or the times that I'm not working. So I love to take my dog out too. We all go camping together on weekends when it's a nice day out. But I know that I enjoy going out to restaurants and finding a new place and finding a new favorite dish. But if it's a long day at work and I'm like, you know what, I'm just really tired right now, I have no shame just vegging out on the couch and watching Netflix. So I enjoy, like, in order to do the best that I can at work, I treat myself the best that I can at home.
I really like that answer, Elena. I feel like a lot of times self-care is rest. And I experience that a lot. As I mentioned, I'm in school, and for the last 3 years, I've been in school and working full time. So managing my outside of work life is also kind of work. And so when the reason I actually switched to dermatology was because I was able to have a 4-day work week and still get my 40 hours. So finding the schedule that works for me was a really big part of having a day a week where I can do whatever I want. Like you guys, I'm Northwest native, so I like to hike, I like to be outside, and I like to go visit my friends. So it's just kind of, finding the schedule that works for you. That was like my big tip.
Very good. We always sometimes wish we can go back and give ourselves advice. If you were to go back and talk to your high school version of yourself, what advice would you give yourself as it relates to your career path and journey?
I would have applied to more colleges. I know that seems really like when I went to apply to college initially, I just didn't. There wasn't like any place where I was like, oh, I want to go there. I just knew I wanted to go to college. So I just was kind of like, I'll apply there and I'll apply there and I'll apply there. And, I did get into college, but I ended up not having a great experience. So I feel like if you are planning to go to healthcare in a role where you do need a degree, then taking the time to really look around and see what's there. And I think a lot of people started that earlier in high school than I did. So that would be what I would tell my past self.
Thank you, Missy. Any other compelling thoughts you would go back in time and?
I think this one thing that I would tell myself, my high school self, is that if someone, you've all probably heard this before, but if someone tells you you can't do it, it's easy to, I guess, let that get into your head and slow you down for a bit, but just remind yourself that, you're the captain of your own ship and you will take it where you need to go. I think that played a role into why I enjoyed chemistry so much, because a lot of my teachers in high school said that's not a great career, that's not a good topic. You'll never finish that in like a timely manner in college. It's very challenging. And I proved them wrong. So I think that was also a big motivation, but it's also, just keep doing your best and keep going after what you love, no matter what anyone says.
That's great advice.
Gosh, both of your answers resonate so much to me. Missy, like you, I only applied to like one or two schools, one or two colleges, and I really wish that I applied to a lot more. And Amber, you're so right in saying that not to listen to a lot of the negativity. For myself, along with all of those things, I would say that it's okay to not know what you want to do. In high school, my thought, I knew I wanted to go in healthcare, but that position in healthcare has changed so dramatically every year that I was in high school. And since I became a nurse, my nursing role has changed significantly too. And as I grow older and as my seasons change, my interests within healthcare change as well. So if you don't know what you want to do, that's okay. Or if you are set on one thing, but then that thing changes or your life path takes you down a different route, that's okay too.
Just one more comment, because you mentioned about the life path taking you like down a different road. That happened to me. So when I went to college initially, I knew that I wanted to be in healthcare and I just had a hard time. And I left and pursued different avenues for careers. And I thought I was going down like this road for like fashion merchandising for a while. And then one day I like woke up and I was like, I still want to be in healthcare. And I just did a 180 and I'm back. So I feel like if you lose sight of your healthcare goals and you're doing something that's not fulfilling you, you can always go back if you want to.
Healthcare will always welcome you with open arms, for sure. No offense to my friends that design amazing clothes or brew the world's best coffee or are changing retail one Amazon sale at a time. At the end of the day, we're delivering a product that frankly all of us will need at given different points in time. And I always tell the recruiters here, as we're hiring people to work with our patients, it's really important to think about them at the bedside or working with a patient or even yourself with a loved one. Is this someone you would feel good about having taken care of? Is this someone that genuinely cares about people and wants to actually make people's lives better? And if they can't say yes about that person, then there's probably a person we shouldn't hire. But again, really, it's a great career. We can't say enough about it, frankly. If you have other questions, we probably have time for a couple more questions if people want to pose them down below. If not, I'll throw this question out to the group. A couple of you kind of hinted at this, but do you plan on continuing doing what you're doing now? Or if not, what is your next step? Where do you see yourselves going next?
Well, since I've been talking about it, so I am actually, this is, like I said, it's my third year being an MA, and at the end of the summer, I'm going to be moving on to finish my degree in behavioral neuroscience at Western Washington. University. I'm very excited. And I mentioned I'm a massage therapist as well. And so my plans are kind of tentative because I think from my experience, I know that anything could happen and something could pull me in a different direction at any time. But right now I'm thinking a lot about clinical psychology and trying to combine that with massage therapy to potentially have some mind-body healing for people who have experienced physical traumas. So there's just a lot, and to think that this isn't even something that I didn't even think about this a year ago. So it's just, you keep going and keep finding things that you want to do because it's worth it. So
Thanks, Missy.
That's awesome, Missy. If you need someone to practice massage on, my back is here for you. Yeah. As far as where I want to end up or what I want to be, I'm glad that Elena and Missy brought it up because I actually, after all of this time of training, I don't know at this point where I want to end up. So I, in a state of mind where whatever comes my way, I'm happy to take it. But so far, I really enjoy Virginia Mason and the culture here and the people. So I would like to stay on, but if something else opens up in a different department, I'm very happy to step in and find out.
I love that too. I'm also ready to volunteer my back, Missy, for you whenever you need. As much as I love the operating room, I'm sure that in the next 40 something years of my working life, my path will change. What I've found out about myself and what I'm trying to figure out to incorporate into my working life is that I really enjoy teaching people. I really enjoy education. I really enjoy sharing whatever knowledge I've learned from someone else with the people around me. So that being said, I'm interested in leadership and management, and there's so many ways to go about that within nursing. Either it could still be within the operating room, but as a manager role, or it could be in a different department. Virginia Mason has so many leadership and opportunities that I would like to continue exploring. But that being said as well, on my off time, on my days off, part of my self-care is working at a different job. But it's a completely different role in and of itself, which I do believe is self-care. I work at a facial plastics clinic where I will soon be learning how to do Botox and filler injections and help out patients pre and post-operatively for whatever type of surgery that they had related to their face and neck region. So I do love being a nurse and I do love being in the operating room, but there are just so many options to follow. And I just want to keep as many doors open as possible because at this point, who knows?
Thank you all. Again, also want to thank everyone for attending today. For those of you who don't know, Virginia Mason is a regional medical center here. We have, is my screen share going here really quick? Come on. There we go. We have medical centers throughout the region, as well as administrative centers. We have at the beginning of this year joined forces with CHI Franciscan to form Virginia Mason Franciscan Health, and they also have locations. So as you see, when we overlap, we're going to be a force to be reckoned with within the region. So I'm obviously very biased. I've worked here for 9 years and involved in the recruiting process. So I clearly have to admit that I have a strong bias about being a great place to work. But I also think the quality of the people here are a great reflection of that. And I can't thank the three panelists enough for making time out of their days, taking time away and sharing their experiences with us. Any other questions we can speak to before we call it an afternoon, and wish you a good enjoyment of the sunshine out there today? Maybe take your dog.